Hi, it's Dr. Ben Thompson with Treble Health. I recently had the privilege of meeting the founder of Tinnitus Retraining Therapy, Dr. Pawel Jastreboff, in person at his home. I want to show a picture on the screen right now of this legendary researcher in the tinnitus and audiology field. Him and I had a conversation, we shared some coffee, and I was able to showcase the recent data that we've compiled with our patients at Treble Health. We studied 247 individuals that came through our telehealth program, and we measured their tinnitus with something called the Tinnitus Functional Index, or the TFI. The Tinnitus Index is the leading way to measure tinnitus, and it puts the tinnitus on a scale from 1 to 100. 100 being the most extreme cases of tinnitus, and 1 being essentially no tinnitus at all. Whenever any group presents data on improvements to tinnitus, we need to have a critical eye when we're analyzing the data. The Tinnitus Functional Index, which for the purposes of this video I will call the Tinnitus Index, has a threshold for a clinically significant shift of anything over 12 points. So for example, if your tinnitus started with a tinnitus index of 60, which is a big problem, then we would need to see a tinnitus index score of 47 or lower for us to say that whatever you had completed, whatever treatment protocol you've been following, has a significant shift. That significant level we call the clinically significant level, and it's what we see as doctors. It's what we need to see to make sure that someone has a significant improvement. Any less than 13 points, 12 or less points, it could just be day-to-day, week-to-week, natural fluctuations of tinnitus symptoms. So if it's over 12 points of a change, this is when the patient will say, yes, I feel better. Yes, there has been a change to my baseline level of tinnitus. That's what we're after. And we would look at the awareness of tinnitus, how often we hear it, also the perception of the volume or the intensity. All of those come into place, as well as subcategories like sleep, anxiety, sense of control, and other elements of what makes up that tinnitus index score.
This is a short interruption from today's video to announce the Tinnitus Quiz. If you're watching this video, there's a good chance that you or someone you know has tinnitus. We know how much tinnitus can impact your daily life, and we're here to help. Visit tinnitusquiz.com and take a 2-minute quiz to receive personalized treatment plans that have helped hundreds of people learn to manage their tinnitus. Start now at tinnitusquiz.com.
So now back to my meeting with researcher Dr. Jastreboff and to showcase the data from our patients at Treble Health. So like I had said earlier, we had 247 patients that we were able to study, and we measured their tinnitus index score at the beginning of working with us, 3 months later, and then 6 months after starting working with us as well. In our study, the average reduction in the tinnitus index score at 3 months was an average of 20 points. So that's clearly in the significance range, because remember, we needed to see 13 points or more in the significance range. So we're very proud of that. But things get even better, because at the 6-month mark, with this cohort that we studied, the average reduction in the tinnitus index score was 25 points. But the results got even better. As we measured this group at the 6-month mark, the average reduction in the tinnitus index score was 25 points, which is about 2 times the significance level of what the creators of the Tinnitus Functional Index had set out. What that means is that what we're doing at Treble Health is really working. And I've compared this data to other products, other options for tinnitus treatment or tinnitus reduction. And I was really amazed to see that what we're doing at Treble Health is the leading approach, the most effective. Now, I asked Dr. Jastreboff, hey, how does this compare to the best practiced tinnitus retraining therapy research? And he said, it's looking good. It's looking consistent with what we had, or very close to it. But let's measure this group at 12 months. Let's measure them at 18 months. Because what the tinnitus retraining therapy research showed is that the work that our patients have done in the first 3 to 6 months has a compounding effect for what happens next. And that's really important to know, because if you're looking at certain research and you're just looking at the 3-month mark, it's not very convincing. We want to see at the 6-month, at the 12-month, even at the 18-month mark, how much better do patients get? What's the effect of this treatment? And how long does that last? We don't want something that just lasts in the short term. We want a permanent change. We want a baseline shift of tinnitus. And so far, that's what our research is showing. And we're really excited to share that. Another way to look at the data is that 75% of patients in our study had a clinically significant reduction in tinnitus within 6 months. So at that 6-month mark, 75% of patients had that 13-point or more reduction of tinnitus. And that's really good for the 6-month mark. I was comparing that to other research and I was really impressed. Now, what we know is the best practice tinnitus retraining therapy research has between an 80 and 85% effectiveness rate. So as a treatment method, that's what we're aiming for as well with our approach at Treble Health. We have some advantages, I would even argue, for why our results could be so good. It's convenient to meet over telehealth. We have consistency and we have some of the best trained and most experienced audiologists across the country who are working on our team via telehealth, meeting with our patients for tinnitus, as well as associated conditions like hyperacusis or even hearing loss. So if your doctor has ever said there's nothing you can do about tinnitus, well, that is clearly not true. This program I've spoken about at Treble Health clearly works, and I'm happy to help anyone who needs it. I'd like to now share a specific case study of a patient. I'm keeping this patient's name anonymous, so for the purposes of this story, his name will be Eric. So let's hear about Eric's individual story and how he got better over time working with Dr. Suzanne May, audiologist on our team at Treble Health. I'm going to reference some notes from the clinical case here, so I may be looking off the camera here. Okay, so Eric's tinnitus started back in July 2022 after attending a loud concert. He was in a state of panic, anxiety, and loud tinnitus. He felt scared and it was hard for him to focus. He was an architect. He heard ringing in both ears. His hearing test showed a moderate high-pitch hearing loss in both ears, but he did not notice difficulty day to day. There was no hyperacusis or somatic tinnitus symptoms, and he did have some significant levels of stress prior to the onset of tinnitus. His tinnitus functional index score, the TFI score, was an 80 out of 100, which means that it's a very big problem. And he wanted to research options. He just needs to sleep. And his ENT doctor gave him some sleep medication, which was not working so well. He was scared about upcoming travel related to tinnitus and to sleep, and his tinnitus was reported as a 9 out of 10. So we asked him, how intense is your tinnitus on a scale of 1, not a problem at all, up to 10, an extreme problem, and he said it was a 9. That patient was connected with Dr. May on our team at Treble Health, and reviewing her notes, she covered in her appointments with the patient, with Eric here, discovered that there were some opportunities to improve the sleep routine to get more benefit out of sleep, better sleep, falling asleep faster. Dr. May also advised different relaxation techniques, as well as sound therapy devices. The patient met with Dr. May every 2 weeks for about 5 months, and 5 months after starting with us, the TFI score, when we measured it a second time, was now a 49. So it moved from an 80 down to a 49. And the clinically significant reduction there that we want to see is anything over 12 points. So we're seeing a 31-point reduction on the TFI in 5 months. That's a significant change. That's really good. Let's see how much lower it can get. Around that time, the clinical notes show that Eric was feeling less anxious. He was having success weaning off of the medication with the guidance of his doctor. He can now sleep without issues. He doesn't need the sleep medication. He uses some custom earplugs in noisy situations, and the perception of the tinnitus has gotten better. So essentially the volume perception has lowered. He still wishes the volume will come down further. The sound sensitivity has improved, and overall he's doing a lot better. So let's see how things progress over time. All right, now 10 months after he started, we measured the TFI score again. And remember that it started at an 80, and now measuring it 10 months after starting working with us, that TFI score is now a 17, which is into the mild range. And remember that millions of people, including myself, live with a mild degree of tinnitus as measured on the TFI. So this is an excellent result. of going from an 80 all the way down to a 17, going from a very big problem down to a mild problem. It took a lot of work. Eric used a lot of tools, sound therapy tools, one-on-one guidance, cognitive behavioral techniques, sleep adjustments. All this was guided by Dr. Suzanne May on our team. And overall, I'm really excited to share this story with you. Eric graduated from our program. So after working with us for about 10 months, he graduated and is now self-managing tinnitus with success. It's no longer a problem in his life, and he's living a full and productive life with work as an architect, with family, traveling, etc. So I'm really happy to share that. I want to bring it all together. So from the initial data that I shared on those 247 patients, that may seem like a nice number, but we remember that with Eric's story, each of those patients are individuals. And when they graduate our program from Treble Health, we're really proud in what we do. And we need to share that message loudly, that there is something you can do for tinnitus, that there are tools and techniques, and there is support out there. So reach out to our team at Treble Health. If you are in need, you can head over to treblehealth.com to learn more about our tinnitus relief bundle, as well as our services with our expert audiology team. Thank you so much. Talk to you soon.